Good afternoon, everyone. I'm Stephen from the Chinese University of Hong Kong and Healthview Bioanalytic Limited. It's an honor to be here today, and I'd like to start by thanking Jumpstarter for this remarkable platform to share our vision and our groundbreaking technology, which identifies children with autism spectrum disorder, ASD, and global developmental delay, GDD. Let me introduce our company first, Healthview Bioanalytic Limited, or simply Healthview. Established in 2015 as a spin-out from the Chinese University of Hong Kong, we are driven by our rigorous scientific research and our innovation to establish a different health risk assessment tool in the hope that we can reduce medical burden in the long run. And since our inception, we have achieved several milestones which prove our commitment to this goal. In 2016, we launched our flagship product, Automatic Retinal Image Analysis, also known as ARIA for stroke risk assessment. In 2018, we rolled out ARIA for cognitive health risk right here in Hong Kong. Last year, we took a bold step forward by expanding our operations into Shanghai. Just next week, we are thrilled to debut ARIA for blood glucose health risk in Hong Kong, a launch which you won't want to miss. Today, though, I'd like to share something deeply personal and profoundly impactful, which is our work on ASD and GDD in children. When I was younger, autism seldom came up in conversations in school or families, but things have changed dramatically since then. Let me give you some background on autism. Since 2000, the prevalence of ASD has skyrocketed by 178%, now touching an estimated 75 million lives globally, equivalent to 1% of the world's population. Signs like limited eye contact, intense focus on specific interests, and repetitive behaviors emerge at any age in autistic individuals. However, diagnosis remains difficult, often requiring multidisciplinary specialists and multiple exhaustive assessments. In Hong Kong here, families using the public healthcare service requires wait time of over 6 months to 2 years. That precious time lost when early intervention can help a child's trajectory. But why do we care this so much? Think of names like Vincent van Gogh, Susan Boyle, Bill Gates, and Elon Musk, who are thought to have ASD or diagnosed with ASD. What unites them is not just their neurodevelopmental condition ASD, but also their special talents. Vincent van Gogh artistry, Susan Boyle mesmerizing performance, Bill Gates and Elon Musk's business acumen. These are testament to their talents. Research actually backs this up. Over 60% of individuals with ASD have special talents, from extraordinary memory to outstanding visual spatial abilities. And notably, 58% show perceptual peaks, compared to just 13% in the general population. So, as you can imagine, with the right nurturing, these individuals actually can have the possibility or probability to shine, enriching society in a way which we only start to understand. This is where Healthview steps into the spotlight. Since 2008, our team has been investigating the retina, a thin layer at the back of the eye, as a unique window into health. Connected to the brain via optic nerve and intertwined with the circulatory system, it can reflect eye diseases like diabetic retinopathy, cardiovascular and cerebrovascular health like stroke and coronary heart disease, brain health like Alzheimer's disease and white matter hyperintensities, and of course also neurodevelopmental condition like ASD and GDD. Our game changer, Automatic Retinal Image Analysis, ARIA, is a cloud-based cutting-edge technology which analyzes retinal images non-invasively, accurately, with no human intervention for health risk assessment. Backed by over 20 peer-reviewed papers and secured by patents in the US, mainland China, and Taiwan, it offers unparalleled accuracy of over 90% in all its application. It's actually not just a tool. It is a revolution in health risk assessment. Collaboration drives innovation. By partnering up with different experts across fields like infectious disease, endocrinology, and neurology, we are expanding ARIA's reach. Currently, ARIA not only addresses adults and elderly needs through stroke risk assessment, cognitive health risk assessment, blood glucose risk assessment, etc. It also addresses pediatric needs through identifying children with ASD and GDD. Before we dive deeper, let me show you ARIA in action. 可以播片，可以播片。
ARIA involves 4 simple steps. First, take retinal images of both eyes using a non-mydriatic fundus camera. No pupil dilation is required. It is a simple, fast, non-invasive method that doesn't require any blood draw or tests. Then, log onto the internet account and upload the images. The ARIA analysis will automatically start running in the cloud server. It doesn't require any human intervention. Analysis results are ready in just a few minutes, meaning analysis can be done anytime, anywhere, making it an ideal tool for telemedicine, especially for rural populations. ARIA involves 4 simple steps. First, take retinal images of both.
So as you can see, a very simple retinal scan, fast and convenient. This is the starting point of what I want to share today. Here is the science behind it. Retinal blood vessels connect to the share the embryonic origin and structure as the cerebral vessel. Our previous research shows that retinal images reflect specific brain markers like microbleeds or infarcts. Given that studies link ASD to specific brain biological markers, we previously hypothesized that using retinal analysis, we can identify children with ASD and GDD. That sounds like a fascinating idea, right? And in 2020, we made a breakthrough. Our study of children aged 7 to 20 with autism reviewed specific retinal markers. For example, larger average disc diameter and larger average cup diameter in those of autism. And with our patented ARIA, we crafted a classification model boasting over 90% in the result. This finding attracts global interest with coverage from Reuters, US News, and beyond. But we didn't stop there. We turned our focus on preschoolers, children aged 2 to 6, within a critical window for intervention. You may think, taking retinal images from preschoolers may be very difficult, but actually, I tell you, it is totally feasible. And in the end, we took retinal images from over 2,000 preschoolers, including 414 with ASD, GDD, or both. Let's take a quick look at our samples. Here is the gender and age breakdown for the cases we have collected. And then split by definite and suspected cases. And then finally, for the age and gender breakdown for controls. With these data, we have developed 4 classification models. The first and the second model try to split between definite ASD cases and definite GDD cases respectively from the control. And in the third model, we separate definite ASD cases from definite GDD cases. And in the fourth model, we try to separate between combined ASD and GDD cases from GDD-only cases. In all these models, the sensitivity and specificity exceeds 95%. And in particular, in the first 3 models, the specificity reached 100%. These findings are actually very mesmerizing. With over 95% accuracy with only just retinal images, with less wait time for families for an assessment, as well as ease the medical burden in a very cost-effective way. and for preschoolers, where ASD and GDD often blur together. This accuracy provides a very reliable assessment, paving the way for intervention that really drive their development. Our impact is being recognized. At the 49th International Exhibition of Inventions Geneva, ARIA for ASD and GDD risk earned 2 awards. The first one, gold medal with the congratulations of jury, and the second one, special prize for Korea Invention Promotion Association. We celebrate this at the reception to R&T Awards organized by the government as a testament to our innovations reach. The Chinese University of Hong Kong and Hillview are redefining how we approach ASD and GDD, delivering speed, accuracy, and hope through ARIA. So, what's our bigger vision? Hillview's ARIA is not just an assessment tool. It also cares about unlocking potential. These conditions are not merely hurdles, but they are also opportunities for one to identify and nurture remarkable talents, be it in art, in music, in mathematics. By capturing them early, we can empower them to grow up as a competent and confident adults who will contribute to society in their unique way. ARIA is the cornerstone, fast, convenient, and poised to change lives. And to the final note of gratitude, we would like to thank Hong Kong community and schools which partner with us. Your support really drives our journey, and we are immensely thankful for that. Here is the list of acknowledgement. And that's all for me. Thank you.
Thank you very much once again, Mr. Stephen Lau.